Welcome, and today we are honored to have with us an extraordinary leader in healthcare. That is Dr. Lisa Tank, President and Chief Hospital Executive of Hackensack University Medical Center at Hackensack Meridian Health. Dr. Tank is a physician leader whose vision is rooted in service, innovation, and a deep commitment to improving healthcare, especially for aging populations.
Promise that this facility goes beyond bricks and mortar to provide high quality, exceptional, reliable patient care to the community.
With a background in internal and geriatric medicine, she has championed patient-centered, value-based care and led groundbreaking work in delirium care, telehealth, and pandemic response. Under her leadership, Hackensack became the first hospital in the nation to receive disease-specific certification in delirium. So, without any further ado, let's talk to Dr. Tank about her journey, the future of geriatric care, and how we can all age better. Welcome, Doctor. How are you?
I'm good. Thank you for having me.
Dr. Lisa, first of all, welcome to ITV Gold. And, your journey, it has been very inspiring. And, as I went through your things and I know certain things of yours, which I want you to talk so that our, younger generation will get motivated. Please go ahead and, talk about starting from India all the way to here.
So, thank you. Thank you for it. When you get asked those questions, it takes a minute to reflect of that journey, and it has been a journey, and it has been an amazing journey, I would say. Doing my medical school in India and then deciding to come to the States, and it's an important path. As I always talk about it with foreign medical graduates, that it takes effort. It takes a very strong determination. It takes a lot of studying. So you can do your medical school in India, but then you come here, there are exams that you have to take, and you have to really gear up to take that on. And once you have those, as I always talk about, building blocks are important. And keeping yourself constantly motivated and having small goals. So you get your exams in. Then you get your residency in. And residency is important because that's what prepares you to understand the healthcare system that you will be practicing in. So one thing I learned very earlier on is never say no.
Okay.
Never say no. There will always be somebody who will tap on your shoulder and say, Lisa, do you want to try this? Initially, you have that anxiety, maybe that's not my lane, and maybe I shouldn't be exploring that. I'm here to become a doctor and that's all I want to do. I think that's a mistake. So if anyone's listening out there, if somebody taps you on your shoulder and says, why don't you try this? The reason they're doing that is because they see something in you. And they see that there's something in you that's a little extra that's going to help you launch. And that's what I have done. And thank God. And I think that's my mother, who from wherever she is always said, don't ever say no. And believe in yourself. I think that's another important part. So as I finished my residency, then my next was in my second year of residency, I saw my patients that were coming in, 70, 80-year-olds.
So you came from India,
yes. Right? Studied in medical school in India, in Jamnagar, MP Shah Medical School.
Right.
Then took the exams as USMLE 1, 2. Applied for residency, ACGME, did my residency in New York. And then by the second year of residency, I realized that I want to take care of older patients. Because they came in with one thing, and they were all independent people. And within the hospital four walls, they developed illnesses that they couldn't go back to being that independent.
Right.
So decided to do geriatrics, applied, interviewed, and was fortunate enough to get a position at that time it was UMDNJ, Rutgers, and Hackensack. So did my fellowship there. And then decided that...
But was it easy doing all that?
I think nothing is easy, honestly, irrespective. It is a mindset because you are moving from, number one, your home. You are coming to a new place. You are making new friends. You are in a new environment. So I wouldn't say it was hard, but it definitely took courage. It definitely took courage. It definitely took some discipline, and it took some patience. Being in a new environment and a new healthcare model. So I would say that is important. Is it hard? Of course it's hard. Medicine is not something like as a cakewalk. But I think people who take on medicine have that mindset that they are ready to work. And there are no shortcuts. So you put your head down, you really develop a mindset of doing your best every single time, but it's also being open and absorbing, because there's a lot of things coming to you from different angles, and being thoughtful of that is important. So as the journey continues in geriatrics, one of the things I decided is there were a lot of folks who were not getting care in their homes. So house call, we started doing house calls. We went to patients' homes and took care of house calls. We decided to have a robust geriatric fellowship so we can train the future geriatricians. Then one of the things that started happening is I wanted to get involved in how is the hospital running? How is medical staff governance? How are we supporting our medical staff to continue to learn and excel? And that's how I got involved in what's called a medical executive committee. And one of the things that Dr. Pranay Vaidya refers is involve the younger doctors in that medical governance. And what that governance is creating what we call as medical staff bylaws. And what they do is they give you a guiding principle, a roadmap of what are the things you have to learn about being compliant. What are the CMS guidelines, the Joint Commission guidelines? So that piqued my interest. So while I had two parallel paths going, I was becoming a doctor and progressing in the journey of geriatrics. I also had that fortunate encounters with mentors who said, why don't you try this? Why don't you come and work with me for a couple of hours? And that's what I would say with both my mentors, Mark Sparta, who was the current president and is now a Northern Region president. He gave me opportunities to get involved in administration, in different projects that were going on. Dr. Sawchuk, Ihor Sawchuk, who was the chief medical officer, asked me, would I be interested in doing certain projects in Office of Medical Affairs and Medical Staff Office. And I think that is where those sparks started happening. And you develop this keen sense and awareness of yourself, that what are you able to give back to an institution that has given you so much, to all your mentors who came before you and created foundation for you to be able to come in. And let's not forget health equity and all those different things, the community that you serve, all those things also inspire you to continue to grow in those positions. And I was fortunate. Nothing happens without having the right people in your life tapping you and telling you. And at the same time, I was very determined to learn, to put pathways and processes into place that will continue to build, but at the same time, elevate the entire medical staff. And I think that's where really that administrative leadership track started. And, both are really integrated. There is no one without the other. You have to be a good clinician for you to be able to function. And then having those opportunities that came up. So very recently, I was the chief medical officer for 9 years at Hackensack University Medical Center. And very recently, last June, I stepped into the acting role of president as Mark Sparta moved into the Northern region. And that acting role really was a whole different perspective on healthcare. It took me out of that medical staff and really showed me, how do you build the infrastructure? How do you make sure that you have the right technologies for the highly skilled team to function? How do you build relationships with your government relations, your community? How do you give back? But how do you also create building blocks and pillars that are going to be, I would say, who will take healthcare for Hackensack University Medical Center and Hackensack Meridian Health into the next, launch us into that top 20 honor roll. So I think those are important things that do tend to, they're always happening around you. You just have to be aware and tuned to it. But I think the biggest thing is you never say no. Anytime anybody taps on your shoulder.
So that is the key to success. Just never
Absolutely.
say no.
Never say no. Because you never know what that one little thing will lead to. And people are out there to help you. And I always say this thing, it's always good to be able to zoom in and zoom out. So right now with my team, they're all experts. I have a highly skilled team, subject matter experts, very, very well trained. But it's important for me to learn that too. So my ability to get into certain weeds, understand what's going on, and then zoom out to look at a strategic picture and look at the next transformation, innovation that needs to happen for Hackensack and for healthcare, I would say, to stay at that cutting edge. But that is important. You have to be able to roll up your sleeves, get into the weeds, but then step away and let your team really grow and prosper. So,
but let's go back.
Yeah.
Coming from India, and you have achieved so much in life that we all are very proud of you.
Thank you.
So tell me, was there a moment when you felt like, hey, this is not for me?
It happens to you every day. You have to be humble. Humility is one thing that keeps you honest to your mission. It happens to you all the time. I mean, if there's a task that's happening or an event or something new that has just come across and crossed your desk, it takes a minute and you're like, maybe this is not what I want to do. But then you are like, maybe this is exactly what I need to do. And the reason you are doing it, because it's your why and your purpose. If you are connected to that, nothing that you are going to come across, it will be daunting. It's going to be difficult. You do have to learn and invest. But the most important thing you have to remember is building a network around you and surround yourself by subject matter experts who you can pick up the phone and say, hey, look, I'm struggling with this. And it's okay. It's okay not to know everything, because I would say the most inspired leaders and who I've been inspired by are folks who said, I don't know this, but I'm going to go learn it. So one of the things I did, and I, as you said, all the things you do, you forget. One of the things I did is a couple of years ago, just before COVID, I said, I need to understand safety and quality better. So what I applied for a fellowship in Greater New York, Safety and Quality Fellowship. And I learned the science of safety and quality. What is performance improvement look like? What does quality assurance look like? What does safety and high reliability look like? So I studied it, and then I applied it. Then came the next thing, saying, you're a physician, you're so into that medical staff. How do you do operations? How do you do management? How do you learn the business, right? And as we all know, no margin, no gain, no margin. Yeah. So that took me to that next step of doing an MBA. And I started with a healthcare MBA, and then COVID hit. And it's okay to pause. That's the other thing I want to tell everybody out there. Everything doesn't need to happen yesterday. If it didn't happen, I had to pause, take a step back because I had to be there. It's okay. And went right back in it and finished the MBA. And I really think that if you have been immersed in anything and then you do your MBA, I think you apply it much better.
Right.
And just because you have an MBA doesn't mean you're going to be that, this terrific leader. It really takes being on the floor, rounding with your teams, understanding what's going on, and really being empathetic and compassionate. Not just, you have to have some empathy for yourself and compassion for yourself too. And as I told you before, be kind to yourself.
I think that's very important in the medical field.
And that is where you are able to give. And I think that's been a keen sense. Does it happen every day? Do you push yourself all the time? Yes, you do. But then you also are surrounded by people who say, take a minute, take a deep breath. It's okay. It's okay to make mistakes, because that's how you start learning. And trust me, once you make one mistake, next time you won't. And that's what we tell the teams too. And that's what we tell our patients. I mean, I have to tie this back. All these things come together. It's connecting all those dots, right? And that's what we talk about in patient experience. Do we get everything right every time? No, we don't. But one thing is we talk to each other and tell each other, we learn from it. We call this near misses, that the harm didn't reach the patient or the harm didn't reach the team member. We sit down and we debrief and we say, how do we create that environment that the team can function optimally? And then we create an environment for patients where we treat them with courtesy and create that safe space. So as I say, we don't get it right every time, but we are going to get it right the next time.
Absolutely.
And we are going to continue learning. Never, never not learn. So I'm learning from you now. So it always works well.
What drew you to the field of medicine and eventually to leadership in healthcare?
So I think that's rooted way before I think mainly from my parents, and I would say my mother. Coming from a family of physicians who always led from the front and always focused on patients and their well-being. So I was taught way early about patient-centered care.
Wow.
And I think that's what drove me to, in a way, to connect with my mother. And that connection is what inspired me. And that's how medicine was really, I would say, in my veins, as they say. And then it was just question of growing up, pursuing a career, and always making sure that you advocated for your patients.
Absolutely. So tell me, like in your role at Hackensack Meridian Health, how has your perspective on what healthcare can be evolved over time?
So my career at Hackensack, I trained at Hackensack. I did my fellowship in geriatrics at Hackensack, so that's about 24 years ago. And what I have seen at Hackensack is really how do we best serve the community? And how do you adapt? How do you pivot? And how do you stay agile? Healthcare has transformed, as you know, and it's always in flux. And what we are seeing is that if you look at geriatrics, it's 65 and over as you define it, right? But longevity has now become a very normal physiological change that happens. So one of the things that we focused on is just because you are getting older doesn't mean your goals of life have changed or you have to adapt. You can still stay very active in the community. You can still stay very active in your passions and dreams. And that's what we did at Hackensack University Medical Center, Hackensack Meridian Health. We became an age-friendly system and to adapt to meet the patient where they are. Not to expect them to come to you in a setting. We will meet the patient irrespective of age, irrespective of physical, mental status. Our goal is to really make sure that we focus on quality of life.
So, doctor, since you are talking about longevity and you are focusing on longevity, as you said earlier, but tell me, like, there is something like deeper, like health span. So tell me, why is that distinction so important?
I think the distinction about lifespan versus health span means, are you adding quality to your years? You're just not adding years. And what we mean by quality of life is, are you able to do the things that you want to do? If there's goals, you wake up every morning, you have a goal. So I have patients who have goals of traveling after they retired from their career, or they're still working and they would like to go on a trip. Now, if there is a trip that you have to do and it includes walking and maybe hiking, you do have to prepare for it. And the key is really making sure that you have all your exercises that you would think would be needed. So either flexibility, cardio strength, and some form of strength exercises. So these are the things. So that's what we define as health span, is putting the quality back into your health and adding that quality into your years. And that's critical because that's what brings you joy.
So absolutely it does. But let's talk about your geriatrics team at Hackensack, which is helping the older, like adults, not just live longer, but live well. So What are some of the ways they are doing all this?
So the geriatric team at Hackensack is integrated into every aspect of as we provide health. It's the model. The model is that it's providing care across the continuum. So in the outpatient setting, as we call ambulatory, as you see your primary doctor, what the geriatric team has done is they do what's called a comprehensive geriatric assessment. And what that includes, it's literally head to toe. So one is the physical exam of it, so your vision, your hearing, your oral health, your skin health. Then comes the mental assessment to really look at your cognitive, and what is cognitive, right? Cognitive is your ability to process information, store it, access it, and then reproduce it. And that's really critical as you're watching your show, as you're reading a book. Is there a meaning there? Is it being absorbed? Are you able to? And then the third part is your social interactions. That is a critical part of your well-being. And as we all know, social isolation can be detrimental, physically and mentally. So what the geriatric team has done is in the comprehensive assessment, they look at your physical well-being, your mental well-being, your mobility. That's very critical. And there's something called frailty. That's a big piece. That means in the next couple of years, how is your body going to be able to handle, God forbid you get sick? Is there a reserve built in? And then we go forward and look at goals of care. We are also very patient-focused, patient-centric. We don't believe in a cookie-cutter approach. We want to understand you. We want to understand what your life goals are. And then we also talk about investment. I always say, everybody invests in amazing portfolios financially. Why not invest in your health? Because that's your wealth, really.
And you're very right.
Yeah.
Health is wealth, as they say, as
As they
everybody
say.
says it. So, and you often mention like biological age over chronological age. So how does that affect how you treat and care for patients?
I think physiology of aging is important to understand. That's why geriatricians are critical in your age span. Biological aging does happen, but there are quite a few things that are not because of aging. So as folks say, oh, I'm just getting older, that's why my bones are getting weaker. That's not true. It is going to be important to invest in your health as preventive health. So what we do is, as you think about preventive health, that means mobility, balance, cognitive, constantly making sure that your brain is stimulated. Social interactions is one very important thing. And then looking at medications. What you do with medication can affect your biological aging. So you could be a young 70-year-old, but if we add any insult of medications, your ability to function as a healthy 70-year-old will go away. So that's where the distinction comes in. Just because you're 90 doesn't mean you can't do certain things. If you've preserved your health, even at 90, you can do certain things. But your body won't do it as fast. So if you ran a marathon at 40, and now you're running it at 80, you're not going to run the same time. But you're going to be able to run it if we made sure that we preserved all the different functions.
And talking about all that, let's talk like prevention. What role does like proactive care play in helping like seniors avoid like serious health issues?
So again, in the geriatric practice, there are different aspects of the geriatric practice. So we have wellness, lifestyle medicine, right? And then there's something called frailty, where what we do is we screen you. We screen you for mental cognitive, right? Your memory. We screen you for your physical ability. That means your balance, your strides, how well you get up from your chair, because quad strength is really critical when it comes to falls and fractures. And then we screen you for for your eyes, your hearing. If you can't hear, you can't see, your mental capacity will go down. Cognitively, that stimulation goes away. Then you get isolated because you can't hear. So you don't go and meet your friends. You don't go to events. So all these things are critical. But then the most important thing, as we all talk about, is screening for cancer and cardiac. As we all know that cardiology, and Dr. Vaidya is in the room, I know, but he believes in this too, that cardiovascular health is really a major reason why people die or cannot pursue the things they do. So checking your blood pressure, checking your cholesterol. These are all screening. These are all important things that you have to keep in mind. And then when you look at cancer screening, it is age-appropriate screening. So if you look at breast mammograms, colonoscopies, things like that. And we have evidence now that if we do catch it early, we can help and we can intervene early. Doesn't mean that that's going to be the end. It's actually something that you can do proactively. And as we all know, where does the anxiety come from? Anxiety comes from not knowing.
Exactly.
Once you know, you have a plan, you follow it, that helps you relax, that tells you, this is what I need to do to make sure that I can meet my goals and my dreams.